There's a heart treatment that's non-invasive, increases your energy and circulation, and decreases shortness of breath and chest pains. If you have a heart condition, you're probably saying, sign me up right now. But just what is this option that isn't often heard of? Nurse Kim Rosser has joined us in the UH Broadcast Center to tell us. Kim is an EECP therapist in the Cardiovascular Services of University Hospital's Samaritan Medical Center. Welcome to the show.
Thanks for having me.
Okay, so EECP therapy. So is that a clue to what this treatment really is all about?
It is. It stands for Enhanced External Counterpulsation Therapy. And I'm a therapist and do that at the center in Ashland.
So what is this an actual treatment for?
Well, it's for patients with coronary artery disease who suffer from angina-type symptoms such as chest pain, shortness of breath, decreased energy, those things.
So if someone has that coronary artery disease, aren't they candidates for an angioplasty or a stent? Most, that's what you usually hear about.
Right. And they could be, and they could have already had that actually, and that didn't quite make everything better enough, so now they want this therapy. Or it depends on their anatomy, the severity of their disease. Maybe they're just not candidates to have those other things.
Okay, so tell us how EECP works.
Okay, well the patients come in and they run a treatment, and there's blood pressure cuffs that are on their calves, their thighs, and across their buttocks. Looks much like a blood pressure cuff. And they pump sequentially, milking blood up to the heart to increase the blood flow, circulation to the heart, so the next time it beats, it supplies blood to the entire body.
Okay, so it's timed with the beating of the heart, right?
It is. They're actually hooked up to an EKG monitor, and so it runs off timing of that. The nurse runs the treatment and syncs it to time just right.
Okay, so how long is a session of something like that?
It's 1 hour. There's 35 sessions, so they do it over 7 weeks, Monday through Friday, 1 hour a day, and that's it.
So how have the results been?
The results are fantastic. The data says about 80% of patients notice a significant improvement. However, we see better than that. Most of ours are at like 90%. They really have an improved quality of life.
So it just gets more blood flow to the area?
It puts more blood to the heart so that on the next heartbeat, it's going to pump all that extra blood out. So it's going to essentially create collateral circulation, which is like extra pathways kind of around the blockage that exists.
Oh, okay. So the patient is completely done after only 35 treatments?
They are done. And the results kind of vary on how long they last. Data says 2 to 3 years. We have patients we have one guy in particular that comes every year because that's when Medicare pays it. They pay it once a year.
Okay, so Medicare does pay it. That's a good thing to know, too.
It is Medicare approved, insurance company approved, yes, absolutely. But he comes back every year because he just loves the results, and so it makes him feel so good that he wants to do it every year. However, I have another guy that's 9 years out, just talked to him a couple weeks ago. He's still feeling fantastic and just hasn't needed it again.
Okay, so it's a very personal kind of thing.
Yeah.
Why haven't we heard about this treatment before?
Well, I think because there's not that many. We are one of 13 in the state of Ohio that actually offer this. So I think it's just not widely known because a lot of facilities don't actually have it to offer.
Okay, well, we want this to be widely offered. It sounds like a great alternative.
It is a great thing. There's actually a picture of a dog's heart that you can see that it shows the difference. They did some films in a cath lab of its heart before and after, and you can see the crazy difference of the blood flow afterward.
Wow, that's fantastic. So this treatment can truly be life-changing for some patients with coronary artery disease. To learn more about it, use the information that's coming up next. And my thanks to Nurse Kim Rosser for sharing such heartening news.
Thanks for having me.
For more information, call the Center for Lifelong Health at University Hospitals at 844-312-LIFE. That's 5433. Or visit www.uhhospitals.org/lifelonghealth.